So this one's for the moms out there who are getting adjusted during their pregnancy but have no idea what they should be getting adjusted in their postpartum. Where I'm going to give you a quick sneak peek. And for starters, you basically just ran a marathon. Do you think that marathon runners train really hard, run the race, and then quit from there? Absolutely not. They have a massive and detailed recovery plan, and you should too. Because you spent months preparing and training for your baby's birth, creating the perfect registry, reading all of the books, maybe even creating a birth plan or goals. But right when your beautiful baby has arrived, you might be feeling surprisingly overwhelmed, physically depleted, and wondering why no one warned you about how challenging the postpartum period would actually be. And while most resources focus on labor and delivery, the reality is that the fourth trimester lasts far longer and receives just a fraction of the attention and the support. So this video is for new mothers who are struggling with physical recovery, the sleep difficulties, breastfeeding challenges, or emotional regulation during the postpartum period, and who are seeking natural, drug-free solutions that support both their recovery and their baby's development. In this video, we're going to be sharing why postpartum chiropractic care is crucial for both mothers and baby's nervous system health. You're going to learn how birth-related stress creates subluxation and dysautonomia, and how these neurological imbalances contribute to common postpartum challenges, and how gentle, specific adjustments can restore the proper nervous system function, creating a foundation for optimal healing, for bonding, and thriving during this critical transition time. So moms, let's start with the stats. It's estimated that approximately 10 to 20% of moms experience postpartum depression, highlighting its significance as a public health concern. Yet the statistic only represents the most severe end of the spectrum. The reality is that most new moms feel unprepared for the physical and the emotional challenges that follow childbirth. And there's studies showing 70 to 80% experience some form of the baby blues. What's even more concerning is the physical toll of birth that often goes unaddressed. Research has documented that during delivery, a baby experiences significant compression and twisting forces as they navigate the birth canal, with pressures reaching from 120 to 500 milligrams of mercury on newborn's head and neck. That's an extraordinary amount of force on such delicate structures. Now, these same forces create physical strain on mom's body too. And without proper neurological support, both mom and baby can struggle to recover from these physical demands. So let's talk about what really happens to your nervous system during birth. Now, birth truly is a marathon, both physically and neurologically, for mom and baby alike. For mothers, labor and delivery demand extraordinary physical exertion, with your body producing complex hormones while experiencing intense pressure, stretching, and sometimes tearing of tissues. Now, these physical and emotional stressors can create what we call subluxation, areas where the communication between your brain and your body becomes compromised. So for mothers, stress and subluxation commonly occurs in the pelvis, the low back, and the upper neck, and sometimes the thoracic or mid-back areas, affecting everything from core recovery to hormonal regulation. Within 24 hours of birth, your estrogen and progesterone levels, which are hormones that were elevated during pregnancy, they plummet dramatically. Now, this abrupt hormonal transformation is often described as falling off of a cliff hormonally, and it profoundly impacts your nervous system. These hormones don't just affect reproductive function, they actually directly influence neurotransmitters within your brain and the balance of your autonomic nervous system. And when your nervous system becomes dysregulated during this hormonal flux, it can lead to difficulty with sleeping, anxiety, temperature regulation issues, digestive disruptions, and heightened sensitivity. But the connection between you and your baby goes far beyond the emotional bond. It's a profound neurological relationship called co-regulation. Your baby's immature nervous system relies heavily on your more developed system for stability and organization. And there's studies that indicate that babies depend on close physical contact with their mothers to regulate their heart rate, their breathing patterns, their body temperature, and their stress hormones. And when your nervous system is regulated and balanced, your baby tends to settle more easily. They feed more effectively and develop more securely. Conversely, when you experience nervous system dysregulation, your baby often exhibits signs of distress, creating a challenging cycle. Breastfeeding difficulties often involve nervous system function, particularly the letdown reflex, which depends on optimal vagus nerve activation. Sleep problems are nearly universal postpartum challenges, and they're deeply connected to autonomic nervous system balance. So a nervous system stuck in sympathetic dominance makes it difficult to relax into deep restorative sleep even when you're exhausted. Postpartum moon challenges represent perhaps the most significant intersection of neurological, hormonal, and psychological factors. Now, physical recovery complications like persistent pelvic pain, incontinence, and diastasis recti often have neurological components that extend beyond simple tissue healing. But this is how neurologically focused chiropractic care supports your postpartum journey. Now, our approach begins with comprehensive insight scans that provide objective measurements of your autonomic nervous system function. Now, scans serve as a window into your nervous system, allowing us to pinpoint exactly where and how subluxation is affecting your neurological function. And then gentle specific adjustments help restore proper pelvic function, reduce the neurotension in your upper cervical spine, enhance nervous system communication for hormone balance, improve sleep quality, support proper muscle engagement, and promote optimal breast tissue drainage. For your baby, gentle pediatric adjustments use pressure comparable to testing the ripeness of a tomato, light and precise to be able to release that birth-related tension and support optimal development. Click the link within our bio to learn more about Haven Family Chiropractic and how we can help you and your family.